Well, today, Friday, marks World Tuberculosis Day. Now, the day is aimed at raising awareness of a disease that kills an estimated 1.8 million people every year. Just 6 countries account for nearly 2/3 of the cases. That's Nigeria, South Africa, India, Indonesia, China, and Pakistan. Resistant forms of TB bacteria are already undermining efforts to roll out new treatments. Henry Ridgwell has more.
Tuberculosis, or TB, is the most deadly infectious disease in the world. World TB Day aims to highlight the burden carried by some of the most marginalized communities.
Every single day, 5,000 people lose their life because of tuberculosis. And TB hits particularly those vulnerable populations that include migrants, refugees, prisoners, people who are marginalized in their societies.
TB is rife in African townships like Khayelitsha near Cape Town, South Africa, one of the largest and fastest growing communities in the country. In recent years, drug-resistant strains of TB have taken hold around the world, posing an increasingly urgent public health threat. These strains often go undetected and are spread across populations. Dr. Kirtan Deda, head of the Division of Pulmonology at the nearby University of Cape Town, spoke to VOA via Skype.
In South Africa, for example, TB is the commonest cause of death, and the disease is out of control in Africa.
But there is new hope. A small number of new drugs have become available.
For the first time, after about 4 to 5 decades, we have 2 drugs. One is called bedaquiline, that has now been registered in South Africa and is available to treat mainly patients with drug-resistant TB. And there's another new drug called delaminate that is not yet licensed in South Africa but is available in other countries.
In a report published in the Lancet Medical Journal, Deda and his co-authors warn that the effectiveness of these new drugs could be lost if they are not used correctly and dispensed quickly.
We need to change our strategy. We need to go out into the community and find these cases. We have to address the major drivers of TB, which is poverty and overcrowding, nutritional deprivation, alcohol abuse, cigarette smoking, and biomass fuel exposure.
Authors of the report say the new drugs must be prescribed as individually targeted treatments with clear dosing guidelines to prevent further resistant TB strains from emerging. Henry Ridgwell for VOA News, London.